This week, Congress will consider a new plan that would make big changes to Medicaid, a program that more than 1 million Coloradans depend on for health care coverage.
Denver 7's Brandon Richard digging into the issue and shows why supporters say the changes are needed and why opponents say it could just make things worse.
Well, because the plan was just released on Sunday night, still too early for state leaders to say exactly how Colorado would be impacted. But nonpartisan analysts say one thing is clear, that some people would lose their coverage. Meg Moore is a vocational program director of a job training program for adults with intellectual and developmental disabilities.
We run a job training program through the forum of a recycling company. So we hire adults who have intellectual and developmental disabilities, and we provide job training on the soft skills of employment to get them prepared for jobs out in the community.
The program is funded through Medicaid.
Many people aren't even aware of what Medicaid programs are because they kind of happen in the background in our communities.
She worries the program's days could be numbered if Congress makes cuts to Medicaid.
And so the loss of those services would just be completely devastating to this community because truly there is no alternative if these services go away.
Republicans in the U.S. House introduced a new bill on Sunday that would require able-bodied adults without children to work, go to school, or volunteer at least 80 hours a month to continue receiving benefits. It would also reduce funding for states like Colorado that offer state-funded health care to undocumented immigrants. Republicans say the plan would strengthen Medicaid by rooting out waste, fraud, and abuse. The nonpartisan Congressional Budget Office says the plan would reduce the deficit by $912 billion over 10 years, but also lead to 8 million people losing their Medicaid coverage.
There are just significant economic consequences to this short-sighted, foolish approach.
Colorado Congressman Jason Crow says cuts to Medicaid will hurt Coloradans.
I pay less attention to what people say, and I pay more attention to what they do and what their plans actually say and what their votes actually do to Coloradans.
The Colorado governor's office is still reviewing the bill, but said federal cuts would threaten the health care of hundreds of thousands of Coloradans, adding that Colorado does not have the resources to bail out reductions made by Congress. Also important to note that this plan is not final just yet. The committee that's marking up this bill will likely make some changes. And of course, there could be even more changes after it gets sent to the Senate. Reporting in Denver, Brandon Richard, Denver 7.
Brandon, thank you. And taking a closer look at the impact felt here in our community, Denver Health says cuts to Medicaid would have a significant impact on its growing financial challenges.
That would hugely impact Denver Health because 49% of our patients are on Medicaid, and that's the primary place that the federal government is trying to take a scalpel or maybe an axe to. I'm holding my breath and my lungs are about to burst.
The hospital says $65 million it's receiving from sales tax will help, and it has Denver voters to thank for helping solve this problem. Voters approved the sales tax ballot initiative back in November.